Good evening again. So this is an interesting case of bilateral nanophthalmos which who presented to our OPD. So these are the normal findings which we get in a patient of nanophthalmos: a thickened retinochoroidal complex, a smaller anterior chamber and a posterior chamber, presence of optic disc drusen's, a narrow angle, and presence of optic pigmentary retinopathy along with the foveoschisis can be present. So this was an unusual case. A 56-year-old female who presented with a high hypermetropia with a vision of 624 in both the eyes and a near vision of N6 with the normal presbyopic correction. Her IOP in the right eye was 28 millimeter mercury. She was already on 4 anti-glaucoma medications. In the left eye, on 1 anti-glaucoma medication, it was 14 millimeter mercury. On the slit lamp examination, her corneal diameter was almost normal, the horizontal corneal diameter. Anterior chamber width was shallow in both the eyes. She had RAPD in the right eye, lens was clear, and there was PI in both the eyes. These are the clinical photos. And on gonoscopy, there was 360-degree pass in the right eye and a 270-degree pass in the left eye. Coming to the fundus, in the right eye, she had, so we expected some optic disc drusen or something if she was a nanophthalmos case, but instead we noticed an optic disc pit which was more easily visible on a 3D, 90D examination. On getting an OCT done, there was an optic disc pit which was confirmed, and there was a serious collection of fluid in the macular area, which was correlating with the optic disc, with the fundus image. And also she had these pigmentary flecks which were present in the mid-periphery, and this was present in both the eyes. Similarly, in the left eye also she had in the mid-peripheral area she had pigmentary flecks. But the left eye, there was no cupping. Her optic disc was normal, although she did have some hemorrhages and hard exudates which were present, which were attributed actually to a hypertension and labeled as a macular BRVO. When we got the biometric parameters done, her axis length was very less. It was 16.78 in the left eye, in the right eye, and 16.56 in the left eye. Anterior chamber depth was also less in both the eyes. Lens thickness was almost normal but slightly higher. Similarly, the keratometry, white to white, was similar to what we measured on the slit lamp. And genetic analysis was done on pedigree analysis. There was no history of consanguinity and no positive family history. It was a sporadic onset. A diagnosis of bilateral nanophthalmos with pigmentary retinopathy with the right optic disc pit associated with optic disc pit maculopathy and angle closure glaucoma was made. And the left eye was angle closure with the macular branch BRVO. Secondary to hypertension with the bilateral high hypermetropia and presbyopia. So she was advised to undergo glaucoma filtering surgery in her right eye. However, she declined, so AGMs were just stepped up. 1 or 2 AGMs were added, and in the left eye, anti-VEGF injection was planned. Coming to the discussion, microphthalmos is when there's an anterior axial length of 2 standard deviation less than the mean for age, and depending on the measurements of the anterior segment or posterior segment, it can be classified either as nanophthalmos, relative anterior microphthalmos, or posterior microphthalmos. Multiple case reports have noted a syndromic association of nanophthalmos with angle closure glaucoma with pigmentary retinal degeneration, along with additional findings of optic disc drusen and foveoschisis, and it has been noted to occur with mutations of the MFRP gene. However, in this case, we noted an optic disc pit, which we believe is the first case to report such an association, as we could not find it in literature. Thank you.
What are your points, Prerna, to support the diagnosis of glaucoma? What the points? CDR I saw. What are the other
the pressure
points?
was not controlled in the right eye on the maximal medical therapy, and there was an optic disc cupping the vessels which were exiting the optic nerve.
Fields were not possible in this patient because
we could not do the fields. No, they might have been possible. The patient didn't come up. We had advised the fields, but
if the patient has both optic disc cup and he or she has also the pit, how we can differentiate between the two?
So we could see that the vessels were similar to when we see a 0.9 on near total cupping. They were exiting, but on the 90D examination, we could see that superiotemporal area, there was a depression which was present, additional depression. And to confirm, we did the OCT, and on an OCT, we could see an area of a pit which was there, along with the optic disc pit maculopathy, the accumulation of the fluid. So that's how the pit was diagnosed.
Most likely the pit is called recurrent CSR.
So, but there was an area of defect also in the optic nerve on the OCT. That's